Most office workers have experienced trigger points without knowing what they are, those specific tender spots in your muscles that, when pressed, create pain radiating to other areas. Understanding myofascial pain syndrome and trigger points is crucial because massage and general stretching, while temporarily helpful, don't actually resolve the underlying problem. Trigger points are hyperirritable spots within top bands of skeletal muscle. They form through a specific pathophysiology. Sustained muscle contraction creates local ischemia, reduced blood flow to that area. This causes metabolic waste accumulation and forms a tender knot in the muscle tissue. Through central sensitization processes in your nervous system, these points cause referred pain to distant sites. The classic example: a trigger point in your upper trapezius muscle might cause headaches, jaw pain, or arm symptoms, not just local shoulder pain. You can learn to locate your own trigger points through systematic palpation. Common locations for office workers include the upper trapezius, that muscle running from your neck to your shoulder, the levator scapulae along the side of your neck, and the suboccipital muscles at the base of your skull. When you press on an active trigger point, you'll feel intense tenderness, and you might reproduce your familiar referred pain pattern. Treatment requires a hierarchical approach, not just symptom management. First, identify and eliminate perpetuating factors. Poor posture creates the sustained muscle contraction that forms trigger points in the first place. Stress increases muscle tension. Nutritional deficiencies, particularly magnesium and vitamin D, can impair muscle function. Address these underlying issues or trigger points will simply reform after treatment. Second, release the trigger points themselves. Techniques include ischemic compression, sustained pressure on the point using fingers, tennis balls, or tools like a Theracane for hard-to-reach areas. Dry needling by trained professionals can be extremely effective for deep or stubborn trigger points. Trigger point injections with local anesthetic provide relief in severe cases. Third, address underlying movement dysfunction. If poor shoulder blade mechanics or weak deep neck flexors contributed to trigger point formation, strengthening and movement retraining prevent recurrence. Here's the critical point about chronicity. Long-standing trigger points create neuropathic changes in your nervous system, making them progressively harder to eliminate. Fresh trigger points from acute muscle overload respond quickly to treatment. But trigger points present for months or years may require extended, aggressive treatment because neural pathway changes have occurred. This is why early intervention matters enormously. The problem with symptom-only treatments like massage and heat is they provide temporary relief by increasing blood flow and relaxing muscles, but they don't deactivate trigger points or address perpetuating factors. You feel better for a few hours or days, then the pain returns. This creates a cycle of dependency on regular massage without actual resolution of the underlying pathology. Combining trigger point release with ergonomic correction is essential. Releasing trigger points while you continue sitting in poor posture just recreates them. It's like bailing water from a boat without fixing the leak. You need both components: eliminate the trigger points and fix the mechanical factors that created them. Self-treatment can be effective for accessible trigger points. Use a firm ball against a wall or lying on the floor to apply sustained pressure to trigger points in your upper back and shoulders. A Theracane or similar tool reaches spots between your shoulder blades and along your neck that are difficult to access with hands alone. Apply pressure for 30 to 90 seconds, breathing deeply, allowing the muscle to release. For deep or persistent trigger points, professional treatment becomes necessary. Physical therapists trained in manual therapy, chiropractors, or physicians performing dry needling can access points you can't reach effectively on your own. Don't view this as failure. It's appropriate escalation when self-treatment proves insufficient. Understanding trigger points transforms how you approach muscle pain. That aching shoulder isn't just tight muscles that need stretching. It's specific pathophysiology requiring targeted treatment combined with addressing root causes. This knowledge lets you move beyond endless massage appointments toward actual resolution of myofascial pain.